Hello, I am Dr. Janet Dewart-Bell, Chair of the Women's Media Center. I am delighted to welcome you to a lecture and conversation about the historical and systematic exclusion of women in American healthcare. This is the third lecture in the Women's Media Center's Beverly Wettenstein series, honoring women's history, and our contribution to the celebration of Women's History Month 2025. Please visit womensmediacenter.com for other lectures and our series, and sign up to receive our newsletter, WMC News. Beverly Wettenstein shared the Women's Media Center's passion for making women visible and powerful in media. She was a renowned journalist, speaker, media critic, and historian who dedicated her career to chronicling the representation of women in national media outlets. She was passionate about commemorating the historical contributions of women and founded the Women in History and Making History Today 365 days a year database. Beverly Wettenstein passed away in 2019, and her endowment has enabled the Women's Media Center to continue to shine a light on the extraordinary historical contributions of diverse women from all walks of life. Today's lecture by Anushay Hossain is titled, How the Systematic Exclusion of Women in American Healthcare History Can Explain the Current, Ongoing, and Already Worsening Health Crisis. Her lecture offers a much-needed examination of the women's health crisis in America. Anushay is a feminist author, podcast host, and powerful women's health advocate who is committed to ending the systemic sexism and racism baked into the American healthcare system. She draws from her best-selling book, The Pain Gap: How Sexism and Racism in Healthcare Kill Women, and her show, The Pain Gap Podcast. Following Anushay's presentation, we will have the pleasure of listening to an insightful conversation between Anushay and Vicky Szabo, filmed in the intimacy of Anushay's home. Vicky has helped to win paid leave, paid sick time, equal pay, and pregnancy fairness policies affecting tens of millions of people. She is a gender equity expert, policy advocate, coalition builder, and the founder and director of Better Life Labs and senior fellow at New America. Vicky has been in the forefront of the campaign to win national paid family and medical leave for over a decade. The shared expertise and lived experiences of Anushay Hossain and Vicky Szabo make for a fascinating conversation that is enlightening and inspiring. It is my honor to welcome the Women's Media Center's 2025 Beverly Wettenstein Lecturer, Anushay Hossain.
Hi, my name is Anushay Hossain. I'm the author of The Pain Gap: How Sexism and Racism in Healthcare Kill Women. I'm also the host of the Pain Gap podcast. Today, I'm going to be speaking to you about how the systemic exclusion of women from healthcare in America has led us to the current and ongoing maternal health crisis. One of the most fascinating things to me about my research and this topic is the role of race. It's really difficult to speak about race in America, but it's also impossible to understand where we are today and where we're going without factoring in America's history. Initially, with slavery, it was actually midwives and women who were completely in charge of labor and delivery in America. To the turn of the century, we really see white male doctors come in and really remove women of color, specifically these midwives, from assisting women in childbirth. And this is also when we see women choosing obstetric medicine and obstetric birth over midwifery. We see in the early 1900s, the turn of the century, a series of legislative actions that really set the groundwork to remove women, specifically women of color, from the childbirth process in America, which helped speed up the removal of women, particularly women of color, from the business of giving birth in America. And there were actually three major pieces of legislation that passed. In 1910, the Flexner Report recommended hospital births and the abolition of midwifery. Then in 1915, we see a man named Dr. Joseph Lee, who labeled childbirth as evil and dangerous. Soon that was followed afterwards by the Department of Indian Affairs, which moved births from home to the hospital. So this was a very strategic plan that was implemented. When we look today at America having one of the highest maternal mortality rates, we really have to go back to what happened in this country at the turn of the century. The fact that women of color, and particularly Black women, are more likely to die giving birth in the States, regardless of educational background or economic background, is rooted in the earliest days when America started removing women from childbirth. The over-medicalization of birth, giving birth in America, has been detrimental to American women's lives. You just look at our larger society. Hospitals are businesses. The amount of money that you make from a C-section birth compared to a natural birth is so much more, and it's so much faster. The rate of C-sections in America has ballooned over 500% in one generation. C-sections are the most common surgery in the United States. And they're really approached very much like, oh, just have a C-section, or it was an emergency C-section. This is a major surgery. And it really combines everything about how we view women's pain, women's suffering, and how we just don't give women any time to rest. Even in the postpartum period. There's a saying in the women's health movement that postpartum is forever. We don't give women any support, not only childcare or paternity leave, but we don't give them any support in the sense of how isolated we make a woman and a new mom in America. And a very interesting metaphor is it's like you have a candy in a candy wrapper. Everyone's trying to get to the candy. And when you get the candy, just throw that wrapper away. But that wrapper is a woman. She's a woman. She's a real life human being. And I think that what frustrates me so much about America's maternal mortality crisis is that it's, I don't want to say intentional, but it's solvable. We have known since the beginning of time, that childbirth is dangerous. Women have been dying since the beginning of time. But guess what? We also have all the resources and all the knowledge we need to prevent this. We know when to intervene. We know when a labor is going to obstruct. We know how to save women's lives, and we're not doing it. That is the bigger question in my work. A lot of people think that I focus so much on maternal health and maternal mortality in my work because I almost died giving birth in America. But that's not the whole story. I focus so much on this because Maternal mortality is an indicator, it's an overall indicator for how well a country's overall healthcare system is functioning and for the overall position of women in society. It is recognized as this indicator by the World Health Organization. In the year 2025, nobody should be dying giving birth. The United States has one of the highest maternal mortality rates in the world. It is considered one of the most dangerous places to give birth. More women die giving birth in America than in any other high-income country, and those rates are rising. We often hear the statistic that Black and brown women are 3 to 4 times more likely to die giving birth in America. But I really want us to zero in on that statistic because, put another way, that is 243% more likely to die. And we really have to zero in on Black women because the differences are always starkest between Black women and white women. The pandemic in 2020, the COVID pandemic, really burst open America's bubble and really exposed to the world just how racialized our healthcare system is. A lot of people that used to blame so many things on race, it became undeniable that it wasn't race that's driving these numbers, it's racism. And this is when the core of my work also really comes in. Soon after I started my research, in addition to the pain gap, which is the difference in how we view and believe and treat and diagnose women's pain versus men's pain, very soon after I started my research, I stumbled upon the credibility gap, which actually Maya Dusenberry has also written about extensively in her work. The credibility gap is just the fact that we don't believe women. Women are not believed. We're not believed about our bodies. We're not believed when we're in pain. We're not believed when we've been raped. We're not believed when we've been sexually harassed. So the larger issue of not believing women, even women sometimes not believing other women and not even believing ourselves, just because we have been told repeatedly that we are not, a credible witness, even to our own pain, even to our own experiences. And then, of course, there's the knowledge gap. There's very little we know, actually, about women's health and research. Women were not included in clinical trials at the NIH, the National Institute of Health, or the FDA until 1993, until the early 1990s. These major government agencies didn't even have mandates to include women in their research. So when I say that the ideal image of health in America is a middle-aged white guy, I say that with a lot of data behind me to back me. I'm going to quickly read from my book because what we were saying about how women were historically excluded from clinical trials, well, we have to find out what women did when we found out about this. All women should be shocked about the systemic exclusion of women from testing and clinical trials, and justifiably so. Between the 1970s and the 1990s, both the National Institutes of Health, NIH, and the Food and Drug Administration, the FDA, along with other regulators, had a policy that ruled out women of so-called childbearing potential from early-stage drug trials. The result was all women were excluded from trials, regardless of their age, gender status, sexual orientation, or wish or ability to bear children. The general justification for excluding women and making the male body the default was that males are cheaper to study because their hormonal systems are simpler. We literally know less about every aspect of female biology compared to male biology. Dr. Janine Austin Clayton, an associate director for women's health research at the United States National Institutes of Health, told The Guardian in an interview, "The good news is that women mobilized after finding out about their widespread systemic exclusion. During the 1980s, a group of American female scientists formed the Society for Women's Health Research to campaign for better health research in women. They teamed up with members of Congress to draw attention to the serious inconsistencies in the medical research and impact they have on women's health. The findings were astounding. For example, in the 1960s, researchers conducted the first trial to look at whether hormonal supplementation was an effective preventative treatment for women, but then enrolled 8,341 men and no women. The Physicians' Health Study from 1982 analyzed the effect of daily aspirin on heart disease, but tested 22,000 men and no women. There was also a 1986 pilot study from New York City's Rockefeller University exploring how obesity impacts breast and uterine cancer that also failed to include women in the studies, even though men don't have uteruses. The list goes on and on. We haven't studied the impact of so many things on women. Women spend 25% more of their life in poor health compared to men. We spend 40% of our lives in menopause. And we're just finding out recently that less than 20% of US physicians are even trained in treating menopause. Our serious lack of understanding of women's hormones, women's menstrual cycles. In 2018, Ambien had to be taken off the market after all these women were getting into car accidents while under the influence of the medicine. We find out that Ambien was never tested for women and that women take 8 hours longer to metabolize this drug. They had to pull it from the market. Heart disease is the largest killer of women in the United States. Still, we think of it largely as a male disease. We think of, and women and men have very, very different heart attack symptoms. This is also something that's incredibly fascinating. Women are 7 times more likely to be dismissed mid-heart attack. We imagine it as a male disease of crushing pain in your heart, and then you collapse in a parking lot. But women have a shooting pain up and down their arms. We feel nauseous. And one other thing I want to say about women's pain, which is really fascinating, is that it's so serious and it's biblical. People know that women have this high threshold for pain. Yet when we tell medical experts that we are in a lot of pain or pain that we cannot manage or need help managing, we're not believed. It's almost easier to not believe a woman and dismiss her and gaslight her than actually give her the treatment that she's asking for or the relief that she's asking for. And we see this, of course, across racial lines as well. Black men and Black adult women are much less likely to receive pain prescriptions, pain medication. We see people who have PCOS or endometriosis, young Black women going to the ER for help, being accused of being drug addicts. So when we say that the personal is political, and when we say things like everyday racism, I mean, women of color really we can't escape. We can't escape ourselves or the system. And in addition to fighting the patriarchy, ladies, we also have a mice patriarchy. Studies show that the majority of lab rats and mice are also male. Women are not just small men. I know it's very hard for people to understand this, but we're not. So my big thing is, until the research catches up with us, women have to be very active and very involved in advocating for themselves in their healthcare. Because yes, people get dismissed, but women die because of it. So the sexism and racism that we see in medicine today have always been there. What we haven't done that we are starting to do now is listen to women, listening to women's stories, believing women, instead of just blaming them. When I was giving birth in one of the best hospitals in Washington, D.C., and I always stress that because people are like, well, maybe you're in a bad hospital. No, it was one of the top hospitals. And I kept saying that I was in so much pain. I had already asked for epidural, and they told me I was past the legal limit. And at one point, I just started shaking. I had 104 fever. I was in so much pain. They call the anesthesiologist over, and turns out that the epidural needle has slipped. So I wasn't hooked up this whole time. And by then I was shaking, I had a fever, they did an emergency C-section. But the thing is, you don't really have to know me to know that I like to stand up for myself and I like to stand up for women. But can I tell you, during those 33 hours of labor, I was so kind and polite to this doctor. And by the way, when they wheeled me into the operating theater and it was time for my emergency C-section, the doctor didn't believe that I was in pain. He wanted me to get up from the stretcher onto the operating table on my own. And I was like, sir, I'm not able to. And then he did not believe me. At this point, I'm shaking with a fever. I've been in labor for over 30 hours. I have a baby. My labor is not progressing. I have a baby stuck between my legs. And this man didn't believe me. And I think about him so much. Because it was in that moment that I realized, is this man sexist? Is this man racist? Is he both? Like, he could not see my humanity. Finally, he had to let the nurses obviously assist me because I couldn't get up from the stretcher. But for years, I kept that story to myself because I really thought that my birth trauma was my fault. This Women's History Month is a great time for us to not only think about how we're going to move forward, but look back on how hard women had to fight for our rights and how important it is to raise your hand to make sure that you're not excluded. It has serious implications for women's health and rights. And quite frankly, too many women have died in the past, and too many women are currently dying just because there's not enough research in women's health.
Hi, my name is Vicki Shabo, and I'm a senior fellow at New America, which is a think tank here in Washington, D.C. I work on family economic security issues, gender equity, and issues around caregiving and health, and the relationship between health and economic security and women's full and equal participation in the economy and in life here in the United States in particular. And this conversation comes after the fabulous lecture that you've seen, and it comes at a time where literally the words women and gender and equity and disparities are being erased by the federal government. And it comes after a period where we saw transformational investments in women's health and a focus on women's health. So we're sort of at this crossroads. And I'm really excited to talk with you more about your book and the history that you know and where you see us going.
Thank you so much. I'm so excited to have this conversation with you, Vicki.
I am excited as well. We should just dig right in. Your work highlights women's health and the history of women's health, knowing where we are right now, where we were a year ago, but also where we were centuries ago. What kind of sticks with you?
I think what sticks with me the most is how these systems weren't designed for us, and they were always supposed to value white lives and white voices more. Something that's very fascinating to me that I speak about in my book that we can always go back to is how at the turn of the century, Black midwives in America, who used to be primarily responsible for childbirth and delivery in the United States, many times they were already enslaved themselves, how this early removal of women from the childbirth process, from giving birth in America, from that process and that handover of that power through a very racist legislation and whatnot. It was done in a very systemic way. Gives us the earliest clues to America's current maternal health crisis, but also how the gaps between white women, Black women, and women of color are so vast.
Interesting and sobering, not surprising. Your book talks a little bit about the concept of hysteria and that this idea that women are hysterical, they don't know what's going on with themselves, they make too much, how that's been used to undermine women's health concerns. And yeah, I'm curious how you see echoes of that today, or maybe more than echoes.
We see so much more than echoes. I like that very much. The history of hysteria in women's health still impacts women's health, and more importantly, your chances of getting a diagnosis to this day. You know, hysteria really is such a trigger for me because it shows us how long women have had to face really deep-rooted sexism and misogyny, and how men's thoughts on women's bodies became law from the ancient Greeks. We're seeing echoes of it now. But what's dangerous about hysteria is that it starts from a place of not believing women, from immediately assuming that the woman is lying, over-emotional, hysterical. And the thing that fascinates me about this word is that it's almost exclusive to women. We never ever call a man hysterical. Oh, no. And every woman, as soon as this word comes up, the reason it triggers me is probably why it will trigger a lot of women. We've all either been accused of being it, acting like it, and it almost always takes away your credibility. It immediately paints you and puts you in the light of an over-emotional person who is not able to control her emotions. And it's a really big problem when it comes to women being able to access healthcare. We don't believe women about their bodies, period. Right. If you've been raped, if you've been sexually harassed, we don't believe women when we say we're in a lot of pain. We don't believe women when they go to the hospital and they're saying, I think I'm in the middle of a heart attack. So something I call for in my book, which I would really love to see, and I think it's it's definitely an American cultural shift that I'm asking for, but it's also very global, is can we start by believing women?
That seems basic.
It seems so basic and it's so simple to say, but it's extremely difficult to do.
Right.
And it's extremely difficult for people in positions of power to do. But if we just start from the place of believing women, we believe a woman when she comes in and says, I think my labor might be obstructing. I cannot carry this pregnancy. What have you? If we believe her and give her what she needs versus not believing her, because the connection between women not being believed and the credibility gap and the number of women that are dying in giving birth to America is something really, really fascinating to me because it's so criminal. It's so criminal, it's so unnecessary, it's so preventable. Yet we allow it, yet we continue allowing it. And it's important that we pay attention to it happening in the world's richest democracy because we have the resources, we have the knowledge. When I was growing up, and I mean, this history is so personal to me. When I was growing up in the 80s and 90s in Dhaka, Bangladesh had one of the highest maternal mortality rates in the world. And it was America that came in and was like, not only helped us reduce our maternal mortality by 40%, but really showed us the link between women's empowerment, economic prosperity, and healthcare. It was America who came in and said, if you give women access to high-paying jobs, contraceptives, family planning, women, hey, guess what, guys? Women don't want to have 10, 12 kids and die by the time we're 20.
Well, and philanthropy played a big role in that also. And so thinking about relationships between governments and private donors and research that tells us about these things.
And also massive conferences. When you look at the 1994 Conference on Population and Development in Cairo, I mean, what was that? That was when population policies shifted, right? It was all about controlling population. How do we make these black and brown babies? Like, there's too many of them being born. It shifted from extremely troubling racist roots to women's empowerment.
Interesting.
How crazy to this concept of letting women control their reproduction and be in charge of their contraception. Wow.
Right. I want to come back to something you were saying about the medical community and how women are treated by doctors. Obviously, there's a long history of systemic racism, and you mentioned Black women's mortality and women of color in general, immigrant women not being treated or believed. I'm curious whether your research uncovered sort of what the medical industry did to promote or propagate those different standards, and also whether you know anything or whether your research uncovered anything about the difference that it makes to have culturally competent care, whether women are believed more by other women doctors, by women of the same race or background. And as we're thinking about this time where inclusion in education is under attack, where education itself is under attack. How do we make sure that we continue a pipeline of medical providers that is in the right direction when it comes to care that is more responsive?
I think that we were at a really, really great place in October 2024, where I think with the last administration and with decades worth of advocacy.
Yes, I was going to say, I mean, this didn't just happen. There was a lot of advocacy, a lot of research, a lot of education leading to a moment when we had a focus on women's health.
Yes. No, honestly, can I tell you the last, the last 4 or 5 years have really been great, because when you had a government who was an administration who was not only listening to feminists and women's rights activists, but genuinely interested in how we can progress as a society, because we are not going to be able to progress as a society if we let 50% of our population, which is women, die in needless preventable deaths. And what I always stipulate, why do I focus so much on maternal mortality and maternal death, is because it's an indicator of how our country's healthcare system is working. It's an indicator of women's overall position in society. So America's maternal health statistics tell us a lot. And I really think that we had gotten to a place where women's health had become what is my mission in life, is to make people understand that it is a human rights issue. Women's health issue is not just something that impacts women. It impacts all of us. One of the biggest, I think, advances that we've seen was the funding that was being available, the Women's Health Initiative, creating an Office of Women's Health at the National Institutes of Health. So from where we were to where we are, something happened. We decided to really reroute where America was going. But I think this is also a very important point, because people always ask me, because I was born and raised in Bangladesh and I'm American and I live in America now, why I'm always harping on about what's happening in the world's richest democracy. How does this impact other women? And it does. You have to pay attention to what happens in America, not because of how powerful the country is, but whatever the opposition to women's health and rights are able to do and get away with in the United States to American women is going to be implemented abroad. And America has been doing this for so long. Right now, obviously, abortion and a federal ban on abortion could be on the table and could be something that we have to really grapple with. But America has been importing its domestic abortion politics for decades. I mean, we have the global gag rule, the Mexico City policy, which says that any agency, overseas nonprofit, that gets any kind of U.S. funding cannot advocate, mention, or even refer on abortion. So this is in countries outside of America, their own government, sovereign countries. So this is actually bypassing what national laws are in a lot of these in these nations. So it's important what happens in America, but it's also important to remember that U.S. foreign policy is extremely powerful. America is one of the largest funders to global health, and one of the largest funders to was education. So I think it's undeniable. I think it's undeniable to have a conversation like this without talking about the fact that research and funding from the United States towards global health and women's health, period, is going to be severely restricted. And I'm really, really worried about that, because we already had a knowledge gap we were trying to close. We already had a credibility gap that we were trying to close, and we were getting there. We finally, women's health was like one of the major things that the Democrats ran on. It was like a national platform. It's incredible to think that that was only a couple of months ago.
Right. But even just sort of taking it out of the realm of politics and putting on our hats about people's lives. Yes. What do we think the effects will be? So I think a lot about women's economic participation, about caregiving, about the relationship between health and work and family and care. And I'm super worried that at a moment where childcare may become even less available, even though we already know there was a childcare crisis, where elder care may be more difficult to find if there's cuts to Medicaid. And there was already a backlog of 700,000 people waiting for home and community-based care, where paid leave policies at the state level may not be as easy to pass because states are worried about budgets and other constraints, where companies are rolling back some of the policies that they had that are inclusion policies. And they're inclusion policies for everyone. They're not just for women. It's for anybody that has a disability or a family care need or any other thing that means that they need to take care of things in their personal lives and be productive workers. I'm worried what all of this means for the roles of women in the U.S. And you make a really good point about the effect of U.S. funding on global policies. But I wonder if you, in your sort of travels, have met particular people that stand out to you as being affected by this. Are there stories that you have or people that you've met when you think about the harm that might be coming down the pike?
I want to say that, first of all, more women are going to be dying. More women are going to be dying across the board. We're going to be seeing a lot more women and minorities lose their lives. We always knew that the maternal mortality gap is going to worsen and widen, and it's already, I think we just got a report like a couple of days ago about how more Black women are dying. So everything we were worried about, that the racial gaps and the maternal rates are going to be increasing and widening.
Well, and rural, I did a report a few years ago on rural health and the relationship between rural distances to hospital-based healthcare and workplace policies, and that's multiracial, depending on where you are.
That is multiracial. We have to think about, I think it's really hard to explain healthcare to people outside of America because this country is so big, not everybody has insurance, and people can't imagine, but the maternity care deserts that we have in the United States. Okay, a lot of people don't believe me when I say this. There isn't like just one image of what's going on. Where you live, and this is going to be widening and expanding, where you live, what state you live in, the rights that you're able to access, and the laws that you have about your body and your health care are going to be shifting, and they're going to be changing. I want to say that this crossroads we're at, just like in the pandemic, it's giving us a massive opportunity because it really is a time for us to recommit. Because what can happen right now is that we can degress and lose decades worth of research and advancements for women's health and rights, or we can advance. This is a time where we really are being tested on, do we really want equality for women? Do we really want to prevent women from dying in childbirth? Do we really want women to be in control of their reproduction? Can our actions match our words? Because one of the most visible and tangible impacts where America could potentially be going is that there's going to be less equality and there's going to be more suffering. And it's always the most vulnerable people in society who will have to pay the highest price. We were closing the credibility gap ourselves by telling our stories. And it's so important for me because we hear this over and over again, but the reason that it's important for women to tell our stories is because you can't always intellectualize, or we don't always have the data or the research on birth trauma or on, medical misogyny. But when women start talking to each other and telling us our stories, you know what we realize? How widespread a problem is. After I had my birth trauma, I kept that story to myself for years. I thought it was my fault.
Well, we think of these things as private. That's
exactly.
part of our cultural
But you also think that you had a role in your own suffering. Instead of this larger issue of the system is not designed to see you. The system is not designed to hear you. Why isn't anyone asking why it's more dangerous to give birth in America than in any other industrialized country? So for me, the lack of research is criminal, and these deaths are criminal as well. I mean, it's a lethal situation that women are in, and the reason that it's criminal is because they're preventable. But I think our larger issue is that our cultural tolerance for women's pain and suffering is very high.
Yes.
Because something that has happened since Roe was overturned was we started hearing more about American women, white American women being denied care, being denied emergency care, dying in, having miscarriages. I mean, what we saw with these abortion deaths and these abortion stories, from Texas to New York to what have you, is that our cultural tolerance also for white women's suffering is very high. And that is a larger problem. If we don't care when women are saying we're in pain, we're suffering, and we're just like, well, it's just you. How are we supposed to move forward?
Well, I think this is where we have to be creative and think about ways in which communities come together and women come together and use this as a time, to your point, to not have this just be about, to have Black women in conversation with white women and to use this as a moment to understand both like what is at stake and what these things look like in people's lives and how we use organizing and mutual aid and the ability to understand other people's perspectives and experiences to develop something that doesn't exist right now or doesn't exist well. And I don't know what that looks like. I think
I think we can say that we need to reimagine women's health and women's health care at a time when...
this is like buying Plan B for your neighbor. This is like stockpiling
I'm
Plan
already
B for your neighbor.
stockpiling.
I think it's both and I think it's not being silent, and I think it's getting these stories onto social media and into media.
I think one of the biggest things, and this is what I was saying earlier, to do is keep speaking up. Keep speaking up and keep reporting what you're seeing. And when I was talking about women's stories earlier is because you think that you're alone in your experience, and then you tell your story, and that's how the pattern is emerging.
Exactly, yeah.
And right now, I think women, I think we got to a place where we had agreed or established that women's voices are important, listening to women is important, believing women's stories are important. But we're at a point now where all of those hard-won gains can really be backtracked, and not just our legislative gains, but also our cultural
gains.
So that's why I like to say that we need to reimagine women's health and women's health care with women at the center of it. I'm thinking about going back to those midwives that we talk about. What happened to that? The over-medicalization and the removal of women from childbirth, I think, has brought us to where we are. But we're also at a point in history right now where a lot of those things are being strategically looked at to be taken down and removed. I mean, the playing field now with Roe overturned is very different than my feminist policy lobbying days, in the early 2000s.
Yeah. And I think even before November, we could see the effects of the Dobbs decision, the overturning of Roe, on Black women in Georgia that ProPublica reported on, and on people who are having to travel very far distances if they were able to get the child care that they needed to do that and had the money to do that. And that's where abortion funds come in, which continue to remain a super, super important source of support in this time. So I'm just thinking about what are the places that we can invest our time, invest our energy, invest our thinking that will help us manage this moment and kind of get to the next one.
I think that's a great question. And I think it starts with investing where you are, where your feet are, your community, your family, your city, your town. I think we're going to have to start looking a lot more local before we go out global. Just because the rules are changing, the terrain is changing. But that being said, we also have a massive opportunity here to say no. We cannot be pushed back to the 1800s. Women have come too far. We are the most educated, the richest, and we have the most resources we've ever had in history. So we are actually coming up against, a real roadblock. And are we going to let it block us? Or are we going to let it encourage us to move us forward? Because the thing about women's health is that it can be used And we've seen it. It's been used throughout history to keep you in your home, to keep you, not to restrict your mobility and your freedom.
So I want to push on one other thing here that I've been thinking a lot about in the last week. I've been digging into data on gender equity and what are Americans' views on gender equity and what are roadblocks in public mind. And in a global study that Ipsos released for International Women's Day a couple of weeks ago, they found that 63% of Americans said that they have a personal belief in gender equality. Which I thought was good until I looked at some of the countries in the rest of the world and we're actually below average. So that was a little sobering, but not totally depressing. Because actually some of the countries that were higher have worse policies or have had worse policies than we have. So that the relationship between how gender equitable is your country and how much do people personally value gender equity were not related, which I thought was interesting. But that 63% is juxtaposed against nearly half of men saying that they believe that gender equality is coming at the expense of men's rights and at the expense of discriminating against men. And so I've been thinking a lot about how do we tell a different story that doesn't pit men and women against each other, but actually name the real culprit in this, which is the economic system that we have, the lack of supports for all people, this individualistic mindset that we have, and the idea that it's your fault, which I think men also, I don't think that that is gendered. I think it's an American thing, and it hits women, and particularly women of color, differently in its impact. And so what I'm interested in is how do we tell a different story about the forces that are holding us all back? And so capitalism, deregulation, and disinvestment in communities and policies that don't center people, whatever their gender. Women's health is a piece of this puzzle. Health generally is a piece of this puzzle because we don't invest in health as we should for people with disabilities or any people of color, or people with chronic conditions. I'm wondering how we tell a narrative that leads us to a more equitable place without continuing this zero-sum mindset that we have. And we see it in economics, we see it in gender, we see it in race. It's this austerity frame that sort of pits people against each other naturally.
Let me start by saying this. I think we need to change how we view women's health. And I really thought that we had gone, probably because I live in this advocacy world and it is, it's my life. I really started thinking that we had gotten to a point where everybody understands why it's important that we all invest in women's health, not just women. And I think for a really long time, we've kind of approached women's health as something that only impacts women. But what we know now from the endless data, endless studies, endless research is that women's health is a human rights issue and it's a family issue. The health of a woman will impact not only herself, but her family and then her community and then the country. So going back to the history of the fact that this is something that America advocated all over the world, linking women's health, linking women's empowerment, and with economic success, with economic advancement. And I think that we still don't view women as fully as human. So I think we really have to accept that women are human, because a lot of things that we're fighting for in women's health and rights are still just very basic. I really think we need to get to a place where we all understand why women's health affects us. What we really need to understand is that feminism benefits everybody. It is for everybody. And more than anybody, we need our male allies. Oftentimes, they are our biggest witnesses. You know, I also always say when I wasn't being believed about my birth trauma, and then later I thought, oh, maybe I'm imagining things. It was my husband who was there, who was like, no, this happened, that happened. And I think a lot of women, I think we are all feminists, and that's how I like to live and be. But I think a lot of people don't know what the words still mean, what the areas still mean. What is feminism? Who is a feminist? Yeah. And why should we care about women's health? Well, let me tell you that from where I come from, we are all feminists. Why should we care about women's health? Because it's a human rights issue that affects our families and our communities and our entire countries. And the sooner that we can accept that, the better it is. If 50% of the population is telling you that they're not getting basic health care and it's affecting them bringing in new life or dying in childbirth, listen, And believe us. I love that we're having this conversation during Women's History Month, because even though I am a professional feminist, it inspires and motivates me so much to see how long women have been fighting, and with so little, organizing without technology, so many things. So I think this is really also a time to go back and re-educate yourself. Go back and see the women that came before us. What would they have done? Yeah. So really, at a time when we're celebrating women's history, let's also remember it and go back and look at it and see what we can learn to apply moving forward.
Yeah, I think that's a great place to end. I have loved this conversation, and so appreciate your work and your passion.
Thank you so much. Wait, is it ending? Should I say? Wait, I'm like, are you leaving?
No.
Thank you so much.